Great, thank you, Allison. So as a wrap up, I am given the formidable task of summarizing in 5 or 10 minutes a 2-hour conversation from 5 really smart people. So again, I want to thank all of the presenters both for wonderful conversations and great presentation. Just to briefly run through I think the issues or the topics that came up for me. One is that virtually everything we talk about is hard to avoid thinking of in the lens of COVID and a potential COVID vaccine in the future. The presentation, Stefan's presentation regarding the Philippines and the events regarding dengue vaccination was so important. Obviously, one, the importance of accurate and messaging out, getting out in front of events so that people and families have understanding and perceptions of the risks of vaccines. I think it was so notable, the completely different perception of the Philippines versus Brazil, where the same vaccine was released to very, very different reception. Then, of course, the ripple effect of concern not only with dengue vaccine, but vaccinations in general, and the drop in vaccinations. We've all seen a drop in immunization rates just overall in countries around the world related to COVID and concerns about accessing medical access. And so it's just so clear that with COVID itself and with the COVID vaccine, it'll be so important for us to make sure that we are messaging correctly, because it's not just going to affect COVID, it's going to affect other vaccines as well. I think multiple presenters noted when you're talking about vaccine hesitancy and you're talking about immunization rates, let's not assume that immunization rates that are lower are due to vaccine hesitancy. We have to make sure that the immunization systems serve the communities well, and the opportunity to get vaccinated is there, and it's made easy for people to be vaccinated, as opposed to assuming that anyone who is not being vaccinated is not being vaccinated because of hesitancy issues. In terms of looking at immunization rates, I think Dr. Bettinger made a point that Dr. Gupta made yesterday, I think, which was so important, which is that when you look at immunization rates, people ask you about your immunization rates in your state or in your country. Those rates are what they are, but even if they are high, it's so important to identify and focus on communities that have particular need that very often have lower immunization rates. It's not what your immunization rates are just in an entire state or in an entire community. You have to identify communities that are not being served well. One just general comment I'd have is, I think there was some, conversation obviously about outreach and how we effectively outreach to homeless population or specific race or ethnicity communities. Many of us have already begun COVID outreach, not necessarily regarding vaccination, but around making sure that people recognize the illness and know how to get themselves tested and give them options so that they can get tested. And my sincere hope is that we're able to translate that outreach that's going on right now, that hopefully is addressing needs of specific communities, to also address their needs when they need to get vaccinated. In terms of vaccine hesitancy, certainly it exists around a continuum. In terms of what works to convince people to get vaccinated, I think that provider recommendations are so important, and an effective provider recommendation is just crucial. There's some conversation about how helpful or not helpful it is to try and influence what people are thinking and feeling in terms of driving immunization rates, though all of this can be hard to tell because all of these interventions are very often interconnected in communities. I think Dr. Lee's presentation was just fantastic in terms of demonstrating a couple of things. One is that we all realize that while we know a lot, there's still a lot more to know about people's perceptions of immunization and the issue of vaccine hesitancy. And her presentation, I think, laid out well, one, the issues that we have in terms of what we know and what we don't know, and two, how complicated but important it is to reach out to communities around the world. So we're not only learning more about what people's perceptions and concerns are about vaccine, but we're learning about them again in their specific communities related to their specific situations. Vaccine mandates and other sort of measures do work, but I think we all have some concerns about whether you would consider doing that in the for a COVID vaccine, at least until the lay of the land is extremely different than it is right now. And finally, I think that I think Dr. Brewer was alluded to it. It's going to be so important for providers to have a message and a consistent message, and a message that they understand and they can communicate well to their patients, to their clients, so that they understand the importance of getting vaccinated, because that's eventually a huge part of success. So we will conclude there. I again will thank everyone, all of the presenters today did a wonderful job. Thanks for a great discussion and great presentations. One note, tomorrow, so this morning we began at 10 a.m. Eastern time. Tomorrow we are back to starting 11 a.m. Eastern time for our third day. It runs from 11 to 2 o'clock. And so we certainly hope all of you tune in and listen in tomorrow, and appreciate everybody who listened in and all of your great questions. So thank you all and have a good day.